Okay, so my name is Nicholas Snell, and this is my 10 articles video project for CHS 211. And here is my research question: how can nutritional intervention during pregnancy and also as an infant affect a person's tolerance for foods and possibly prevent food allergies? And this is my inclusion and exclusion criteria. I'm looking for articles that focus specifically on how diet during pregnancy and also as an infant will affect a person's allergies, their food allergies, as they grow older. Some of the articles I came across include information about different possible sources of allergies, like having a pet as a child, and also different types of soaps and lotions that can cause skin problems, which can in turn possibly cause allergy problems. But I'm focusing mainly on the nutritional factors and how diet can um, either cause or prevent food allergies. So these are my 12 articles. The two that I haven't read, this one and this one, are the two that I'm not going to be using, and then the other 10 are there. So it's titled Allergy, Influence of Early Life Exposure to Peanuts, and this one starts off talking about their investigation, I guess, techniques, and says the systematic review evaluated studies that aimed to investigate dietary food allergen consumption or avoidance behavior in early life and subsequent development of food allergies, with a particular focus on peanut allergy. A lot of articles focus specifically on peanuts because peanuts are the most children. So then the article goes on different being the mother's diet during pregnancy and lactation, and the second one is the childhood diet. So for the first one, the mother's diet, they basically come to the conclusion saying the authors reported that there were no statistically significant difference in whether mothers changed their peanut consumption, if they reduced or avoided it, and whether their children were sensitized to peanuts. So they basically came to the conclusion that the mother's diet, whether they avoided their peanut consumption or continued it normally, it had no significant change in how their child was affected by peanuts. The second subtopic, the childhood diet, was a little bit more interesting to me, and evidence suggests that prior oral exposure of high doses of peanuts can inhibit subsequent desensitization to immunization with the same allergen. Under certain conditions, however, sensitization and IgE antibody production may be provoked by oral exposure, and may be more effective in this respect than normal dietary exposure. So, again, not much of it, more so than the mother's diet, but the child's diet can possibly cause or prevent peanut allergy. So moving on to the next source, is titled, Can Early Introduction of Egg Prevent Egg Allergy in Infants? A Population-Based Study. So similar to the last one, but with eggs instead of peanuts, of course. And under their discussion section, they kind of open it with this fact that this is the first large-scale epidemiologic study to examine relationships between timing of infant feeding milestones to subsequent risk of challenge-proven allergy as in an unselected population. So not only do they talk about the food, so previously it was common belief that certain allergenic foods like eggs should be not introduced until the diet until they were 2 years old, but then they kind of go against this idea here where they go so far as to suggest that previous expert recommendations, like to delay egg introduction until age 2 years, might in fact have contributed to the epidemic of the apparent increase in food allergy over the last 10 years. And our data strongly suggests that introducing cooked eggs at 4 to 6 months of age might protect against egg allergy, and that delaying introduction to 10 to 12 months of age might in fact exacerbate it. It's best to have eggs earlier in life because it can help prevent egg allergy rather than possibly causing it, like waiting for longer until 2 years. So my next one is early exposure to cow's milk protein is protective against IgE-mediated cow's milk protein allergy. So here they say early exposure to CMP, which is an abbreviation for cow's milk protein, as a supplement to breastfeeding might promote tolerance. And finally, soy is a reasonable feeding alternative in patients with CMA, and CMA is cow's milk allergy. And this article also includes a lot of visuals like graphs and charts. As you can see here, this one is the age at cow's milk protein introduction. But anyways, it goes on to say perhaps most important finding is the fact that the development of IgE, CMA, cow's milk allergy is influenced by the timing of exposure to CMP. Infants whose regular exposure to CMP was withheld until the age of 4 to 6 months were at highest risk of IgE CMA. So similar to what they were saying last time is that waiting longer can possibly cause more problems rather than exposing the child to the protein right away. And then my next article is factors associated with the development of peanut allergy in childhood. So another thing about peanuts, say the absence of an association with maternal consumption of peanuts during pregnancy, combined with our inability to detect specific IgE to peanuts in cord blood arteries against the saying that they didn't find anything that leads them to believe that a mother consuming peanuts while she's pregnant will cause the child to become sensitive to a peanut allergy. The common use of prescribed and over-the-counter preparations containing peanut oil, nut oils, and proteins, and soy oil potentially represents an important cause of sensitization. Continual exposure through the skin might perpetuate allergy and inhibit the development of the immune tolerance. So they're saying rather than the mother's diet and whether she consumes peanuts, this is more of a problem, the peanut oil and possible peanut products in medications. So my next one is the prospective study on the atopy preventative effects of maternal avoidance of milk and eggs during pregnancy and lactation. Simpler, they have allergy prevention, atopic dermatitis, food allergy, and sensitization, which are all pretty much the same keywords that I have in my project. Their conclusion was that while breastfeeding should be promoted for children at risk for atopy, mothers can be encouraged to stay on normal diet during pregnancy and breastfeeding periods. Prospective study breastfeeding compared to breastfeeding with maternal dietary restriction is negligible. So they really didn't find anything based on the mother, whether she's pregnant or breastfeeding, that will cause a problem in the child. This next one is the introduction of solids in relation to asthma and eczema. At first I wasn't sure if I was going to use this one because it's focused on asthma and eczema, not necessarily food allergies, but I realized that after doing a little more research, asthma and eczema are actually allergenic diseases or atopic diseases. The aim of this investigation was to explore whether late introduction of solids is protective against the development of different wheezing phenotypes, atopy, and eczema in population-based prospective birth cohort. They found that late introduction of egg and milk significantly increased the prevalence of eczema at age 5 years in unadjusted discussion. The results from this population-based prospective birth cohort study on asthma and allergy provide no evidence for a substantial protective effect of late introduction of solids for the development of asthma and eczema. On the contrary, there was a statistically significant increased risk of eczema in relation to late introduction of egg and milk. So again, same thing as before. They basically say introducing it later in life can cause more problems. And they go on to say about asthma and wheezing. When considering the different wheezing types, the hypothesis that late feeding of solids is protective against that development of asthma and atopic sensitization allergens was not supported by our results. So as far as asthma goes, different than eczema and food allergies by their results. So moving on to the next one, food diversity in infancy and the risk of childhood asthma and allergies. And again, here they defined their keywords: asthma, allergic rhinitis, atopic eczema, wheezing, food diversity in children. And under associations between food diversity and asthma and allergic symptoms, at 6 months of age, less diversity of foods was associated with an increased risk of allergic rhinitis. At 12 months of age, less diversity of food was associated with increased risk of asthma and its phenotypes, wheeze, and allergic rhinitis. Diversity of foods at later ages that can cause problems. In their discussion, by 3 and 4 months of age, the diversity of foods was not associated with the risk of asthma and allergies in childhood. By 6 months of age, less diversity of foods was associated with increased risk of allergic rhinitis, but not with other endpoints. And by 12 months of age, less diversity of food was associated with increased risk of any asthma, atopic asthma, wheeze, and allergic rhinitis. In line with recent suggestions that early complementary feeding might protect against the risk of atopic diseases, our current findings complement this evidence based by showing that the diversity of food during infancy plays a role in the development of allergies. So, breastfeeding as a child, it is very important to include fruit and vegetables and help prospects for prevention of food allergy. And they go on to say about allergen exposure. The results of this landmark trial were recently published and are the first level evidence to show that the early introduction of peanut between 4 and 11 months is protective against peanut allergy in infants who are at high risk. In the meantime, there is now strong consensus that delaying the introduction of allergenic solids is unnecessary and harmful. So, waiting longer to introduce different types of foods can cause problems in children, rather than what it was previously believed that it can help. Diet and variety. In addition to allergen exposure, the nature and quality of an infant's diet may also play a role in food allergy development, with evidence that there have been substantial changes in dietary patterns, both in mothers and their infants, over the period of time that food allergies have risen. It also goes to talk about vitamin D and how a lack of vitamin D can cause problems in a child, and a possible vitamin D supplement can help avoid these problems. And my next one is an impact of the diet on serum fatty acid and lipid profiles in Polish vegetarian children and children with allergy. And it essentially compares the diet's lipid profiles in students that are vegetarian versus omnivorous. Significantly higher concentration of linoleic acids in vegetarian children in comparison to allergy group indicated possible alternative path of lipid metabolism in study groups, and in consequence, some elements of vegetarian diet may promote protection against allergy. Vegetarian children have higher linoleic acid levels and help prevent allergies. Serum lipid and fatty acid analysis. No significant differences were observed in triglycerides, total cholesterol, HDL cholesterol, LDL cholesterol, and saturated and monosaturated fatty acids in serum in the study subjects. So that really was not or omnivorous. This is my first article in utero and in infants of sensitization to peanut allergy. Article because in their discussion they state our study supports the hypothesis that early exposure to peanut allergens is a risk factor for the development of peanut sensitization. We found that the peanut consumption during pregnancy by the mothers of the children in the peanut sensitized group was greater than the peanut consumption by the mothers of early consumption of peanuts can cause peanut allergies, which basically is in contrast to all the other articles that I have. And then I noticed that this was published in 1999, which is almost 19 years ago, or excuse me, almost 18 years ago. So some of the other articles were talking about how this was common belief in the past, but proven due to modern experiments that it's not true. And since this was published in 1999, I figured that is one of those articles that falls into that category. And then my last article, which is also my second article that I'm not going to be using during pregnancy, I just decided not to use it. He talks about fatty acid consumption during pregnancy and how that could possibly affect the child. It says, overall, our data suggests that maternal consumption of butter during pregnancy may be potential determinants of allergenic rhinitis in the offspring. So it is the mother's diet during pregnancy affects the child, and I wanted to focus more on how the child's diet is affected. So those are my 12 articles, and yeah.